Buenas tardes. Antes de iniciar la transmisión, los invitamos a colocar los subtítulos o closed caption. Pueden hacerlo dando clic al botón que dice CC de subtítulos o closed captions y luego revisando de que los settings estén en español. Esto lo hacen presionando el símbolo de herramienta y luego donde dice subtítulos CC cambiándolo por el idioma español. Good afternoon, everyone. Welcome to a slightly different episode of EDUCA's webinar series, Dialogues with Science. Today, we will continue to talk about COVID-19 in children and what it means in terms of going back to in-person schooling. For this episode, we will be talking with Dr. Sukanya Prasad from Public Health Literacy. Public Health Literacy is a digital learning and information exchange platform that facilitates the dissemination of public health knowledge in regional communities among health professionals and the public to influence better health outcomes. As for Dr. Sukanya, she is a family practitioner, public health practitioner, and medical officer serving both the public sector and the private sector, spanning 25 years of dedicated service. She is currently a director and founder of the Miracle Medical Center in Morant Bay, St. Thomas. She is also a resident medical officer for the Ministry of Health Jamaica, Golden Grove Sugar Estates, St. Thomas, Jamaica, and Diabetes Association of Jamaica, serving the parish of St. Thomas. She is one of the founding directors of Public Health Literacy. She holds a medical degree from Bangalore University, India, and a master's in public health from Walden University, USA. For us at EDUCA, it is a pleasure having her with us today. This interview has been divided into different parts. We will begin speaking about COVID-19 disease, followed by COVID-19 in children, what it means for in-person schooling, and finally, conclusions and recommendations. Thank you again for accepting our invitation and for joining us for this interview. Let's begin talking about COVID-19 disease. What do we know? How does it spread? What are the main points that we have to have in mind about this disease?
Hi, morning, afternoon, Vivian. Thank you for giving me this opportunity this afternoon to share with you my little sense about the most spoken topic in this unprecedented times that we are living currently, COVID-19, SARS-CoV-2. COVID-19 is an extremely infectious viral disease with a worldwide recording of 125 million cases, affecting 219 different countries. And these viruses they're a group of viruses. And let me tell you from that they've been in existence from before. It's not a new coronaviruses. There are not new viruses that have been existent before. They are a group of viruses covered in a little protein spikes that look like a crown, and hence the name corona. This virus that causes the COVID-19 is mainly transmitted through the droplets generated when an infected person coughs, sneezes, or exhales. These droplets that are coughed up, they're too heavy to hang in the air, so they quickly fall on the floor or the surfaces. One can get infected by breathing in the virus if you're within a proximity of someone who has been infected with COVID-19, or by touching the contaminated surface and then touching your eyes, nose, or mouth. COVID-19 spreads very easily from person to person during the close contact with contaminated surfaces, and it's also spread through the airborne transmission. What I want to really make sure to stress to your audience is that coronaviruses do not spread between animals and humans. That's an important take-home thing. It is not a virus that spreads between animals and humans. There's been a debate about bats and frogs and things arising from the country of origin suspected. But I do want to stress this morning to your audience that coronaviruses do not spread between animals and humans.
Thank you. I had no idea that because of the spikes, the name corona was related. So this is something very new me, and thank you for stressing that animals don't really have an influence in the transmission. I know this is something that has been talked about a lot, and it's still a myth that we need to bust and make sure that everybody understands that this is something mainly between humans that is transmitted. So we know the way that you get infected, and we know that we have some protocols that have been in place for over a year now, and that we have to continue leaving with these protocols. We have to use the mask and we have to wash our hands. Those are the main things that we have going on for us now. Would you add anything else, or do you think that's the main that we have to focus on?
I also wanted to add on, who does it infect mainly? You know, because the myth is COVID-19 virus infects elderly population. But I want to stress this morning that virus COVID-19 infects people of all ages. However, the evidence to date suggests that there are two groups of people who are at a higher risk of getting severe COVID-19 disease. These are older people, that are people over 60 years and older, and those with underlying medical conditions, such as someone with cardiovascular disease, diabetes, chronic respiratory diseases, cancers. You know, the risk of the severe diseases, what we have seen in the last 1 year is that it gradually increases with the age, starting in and around 40 years. It's important that adults in this age range protect themselves and in turn protect others, you know, family, children, and the elderly that are in the home, in the communities that may be more vulnerable. That so I want to really stress again, COVID-19 virus infects people of all ages and not just the elderly population.
Thank you. Before we go into that specific point that it affects everybody and we start talking about how it affects children, you just mentioned protection. And I was mentioning a few minutes ago, masks and washing your hands, but we also have vaccines now. So yes. Is this something that you understand will help with this pandemic? Is this part of our protocols? Should we all try to get vaccines as soon as possible?
Okay. Before I really explain to your audience about the vaccines itself, there are a lot of challenges that, and the most debate that goes around is that the virus has been going through a constant mutation. So the more it spreads, the more it replicates, the more there is a likelihood of mutation. So the most common question is asked, am I being protected with the viruses that, the vaccines that we have now? Is it protecting me against all the variants that we have known so far? You know, sometimes it's common with the coronaviruses or viruses in general. They emerge, the variants emerge and they do disappear. Sometimes the new variants emerge and persist. Multiple variants of the virus that causes COVID-19 have been documented globally during this pandemic. The difference between the UK strain and the strain from South Africa is what we call the N501Y mutation. That's the only common thing that I have with those, you know, but otherwise there are different viruses. They are continually mutating because few people have been vaccinated globally. So this is where your question of vaccinating comes to me. The reason the virus is still mutating is that we have not had a major population globally vaccinated. So according to the former director of the FDA's Office of Vaccines, in his own words, if I'm to quote it, he said, the virus is loving the fact that there are plenty of people that they can infect. So they replicate more, they mutate more, you know. So we need to stress way we can contain this virus and this pandemic is by containing the viruses, the host itself. So the more people we have vaccinated, the less hosts that are available for this virus. So it gets less hosts to replicate, so it has less chances of mutating. They are made, even though these mutation and the viruses have been concerned, many people have been talking about, is there an increase in number of cases because of mutation? Yes, there is a major concern. They spread faster, they're more transmissible, and they're more infectious. But they are definitely not associated with a higher death rate, or they do not cause more severity in illness. They behave pretty much same like the previous strains. What we do not know about these variants is that how widely these new variants have spread. We don't know how the disease caused by these new variants differs from the disease caused by other variants that are currently circulating, how these variants might affect the existing therapies. So, Vivian, to answer the question, yes, we need to vaccinate as much as possible to contain this virus transmission and the spread.
This is something I had never thought about, and it's actually quite logical. If we don't get vaccinated and we don't get that protection, we're host and we're available for the virus to come into our body and to keep on replicating. So it's very interesting that you point this out, and I think it's something that we have to stress, that we have to have this conversation going on. If we're not vaccinated, if we don't have the antibodies, we're allowing the virus to come in, to mutate, to spread more. So thank you for pointing that out. We should continue talking about COVID in children. What do we know about COVID-19 in children? Do they get infected? How at risk are they? How does it spread among children? What information do we have about this?
Okay. While fewer children have been sick with COVID-19 to data compared to adults, I do need to stress that children do get infected. They do get sick with the virus, and the virus can actually spread to others. The kids can actually spread virus to others in the family, in the schools, in the communities, because just like the other adults, kids can be asymptomatic. And while they're asymptomatic, they can still spread the virus. That's the critical point here. Kids asymptomatic will spread the virus. Most children either have mild symptoms or no symptoms at all. Some children get severely ill, especially the ones with the predisposing conditions, the predisposing medical conditions like asthma, sickle cell disease, diabetes, those children that are born with congenital heart diseases. CDC and the partners, they're also investigating a rare but a serious medical condition amongst children, and that's called multiple system inflammatory syndrome. We do not know what causes this inflammatory syndrome yet, or who are at risk yet. They're still under investigation as the COVID is evolving, as we are learning about COVID more and understanding the seriousness of COVID, and it's being studied. We are still in the process of understanding the extent of this inflammatory syndrome in children. What we do definitely know that babies and children under 1 year, they are more at risk, and teenagers, the adult children, they are at more risk, and they are also at risk just like adults. So you have teenage children who are in high school, they are in the middle school, they are more able to spread the viruses, and they interact with other kids, they interact with the parents, family at large, communities. So the virus is able to spread. So children are really at risk for COVID-19. I want to stress that this morning. This coronavirus is not targeting adults and elderly and over 60. We have a saying in Jamaica, oh, this virus has come to kill the geriatric population. So kids are not going to get infected, and that's a myth. And we want to use this platform this afternoon for your audience to stress that, please remember, children do get sick.
Thank you. Yes, I think there's this understanding about children and COVID. Many people believe that because they are at a lower risk, because maybe they'll get fewer symptoms, and that they simply won't get sick.
Yes.
And I'm sorry, but they will get sick. And I guess children need to follow the same protocols that adults have to follow.
Yes.
Except for vaccines, because we know there aren't any vaccines available for children yet.
Yes.
But as far as using masks and washing their hands, this is something that children have to do. And now that I start mentioning this, that using masks and washing hands is something that they have to do, what does public health literacy and what do you as a doctor have to say about in-person schooling?
Can you repeat that question for me?
Yes.
Last bit.
I just want to know what you have to say about in-person schooling, about going back to school in person.
Okay. Vivian, you and I know, and especially as a mother, and being a mother for my own biological son and for many children in the society here, we do understand how important school is to our children. Now, it's not just for the education, but generally it's also for their well-being, their mental health, their developing social skills, their interactional things. And it also in a way helps them to become adults, to learn, to say it all makes them street smart. For some children, it is the place for a healthy meal. Many countries have tried opening the schools, including Jamaica, as we have tried to bring the virus under control as a part of our plan to bring normalcy in the countries. What we need to understand as public health experts is that schools do not operate in isolation. And all children of different ages in the school system do not understand the seriousness of grave situation we are in. Because we have toddlers 5 years and above in school, and we have 15-year-olds in school. The knowledge, the extent to which a 7-year-old understands the grave situation we are in is not the same as a 15-year-old understanding. And sometimes it's very difficult to get the 5-year-old, the 7-year-old to have the mask on for the day, for the 6 hours, the 8 hours they are in school. This is most common complaint I hear is, oh, we do get suffocated. We cannot breathe properly, and children, they're playing, they're dropping the masks off, and the same mask, they might take it and wear it back again. And some kids, they're, wearing the mask below the nose or below the chin. It's going to be very difficult. And we need to understand that schools are a part of our communities, country at large. So we have to bring the control of transmission of this virus in the schools, in the communities, so we can address the pandemic and bring it under control so we can have a normal life if it's possible again. We need to understand the transmission and the development of the disease amongst children. That's very important, because we might have kids with a little runny nose or a common cold, and we think, oh, that's just common cold, you know. But studies have shown to us, and WHO has on its website showing us every day that children who have contacted the virus, even though they're asymptomatic, they have infected their parents, the grandmas, the grandparents in the family, and also infected the communities and neighborhood. But as I said earlier, Vivian, I want to stress again the difference between the younger and the older teenage children. You know, younger children transmit less to other children, but teenagers' transmission rates are almost as equal or high as adults. So this is a very, very critical thing in thinking about school and children being in person in school. We have to understand that all children do not understand the extent of the damage that this COVID has created to worldwide. And we, you know, it's very difficult to get them to understand, because it's confusing to them too. Because they've always been used to playing. Most children go to school to interact with friends, not to learn until they reach certain stage. They don't know they're going there. And before that, I said, some of the kids, it's the only place they get a healthy meal for the day, right? So that's a fact that we, as public health experts, we cannot shy away from that fact, you know. But we have to address, and this is very serious situation. It's very difficult even to get our adults to wear a mask, stress hand washing, sanitizing, even respiratory hygiene, just to cough into a tissue and dispose it the right way. It's very difficult amongst adults, because they keep complaining that, oh, we can't read all the time, doctor. It's very difficult. We need to read sometime. We need to get fresh air. So it's kind of difficult with schools and children at this time.
Thank you so much for being so honest and open about this topic. It's been something we've been discussing for a very, very long time here. We've already been without in-person schooling for a full year, and it's been very hard on our kids all over the country. There's a lot of movement going on, trying to get kids back to school, especially because everything is open and working. So the only place kids cannot go is to school. They can go to the supermarket. Well, everybody can go to the supermarket. Everybody can go to restaurants, to malls. They can go to friends' house. They can, people go to work. Our tourism is open. Our frontiers are open. So it's like we can do everything, but we can't go to school. And that's something that worries us. And we don't really know how to continue addressing the issue, because we understand that there are risks, but we also understand the necessity of them going back to school. So considering that everything else is open and that everybody's practically living a normal life using masks and washing their hands and trying to get vaccine when they are available, do you think schools can be a safe place? Do you think introducing the right protocols, having differentiated groups, maybe smaller bubbles, or implementing a specific timing and schedules for different groups, you think that's possible for schools to be safe?
Vivian, that's a great question, and that's the most debated question at all levels until this day, but having been a part of the public health decision in my local area, and having gone through since September, school opening, closing for a couple weeks, and then there is an outbreak of 1 or 2 cases, either a teacher gets infected or a student gets infected, then we have to follow the protocols and close that to completely sanitize the area and the schools and the buildings. What WHO and CDC recommends, and we all have to agree with that because that has come with a lot of studies and evidence and things, is that each school, each community has to do their own risk assessment. Because every school is not the same, and every community the school is in, they're not the same. And every country is not the same, because the opportunities, the resources, the buildings that United States can afford, third world countries, the Caribbean countries like us, we may not be able to, because it's taken a lot of resources from the government we already don't have. So the protocol that WHO recommends is that look at the school themselves, look at the community they are located in, look at the incidence of the rates of COVID-19 in that community. We need to look at the buildings of schools, the number of classrooms that are available. How are we going to make the seating arrangements 6 feet from each other? Number of hours the children will spend at the school, how much can they afford a hand wash station? How ventilation in the classrooms? Are there any boarding in schools? I am not sure if in Dominica we have the boarding in schools. Some of the schools in Jamaica, we do have boarding associated with the schooling. Some children from far areas, they live on the campus. And is it, overcrowded? What do you do in that situation? So what we as public health experts and from public health literacy, what we think is that we need to assess if we can apply all the public health measures at a particular school, like social distancing, hand wash, sanitizing, respiratory hygiene. Do we have sick bays? Do we have an isolation area? Do we have a nurse available at all times of the school hours? Make sure they have a plan at hand. What if there is a case? What if there is a suspicion? Because you can have an asthmatic a kid in school who is having shortness of breath, and you might oversight it and say, okay, that kid is an asthmatic. No, it may not be. So that's a case of suspicion at this time. So what do you do immediately? How quickly can you contact a public health department? What plans the schools will have to get that child tested? What plans do they have to transport the kid to the school, to the public health system to get the test done as quick as possible? How to sanitize that area in the school after? And also we need to bear in mind, schools do have responsibility of contact tracing, because in the 6 hours that they spend in the school or the 4 hours they were in school, because I hear you saying cutting down the amount of hours spending. Yeah, it doesn't matter, 6 feet away, a child who's infected coughs, the other one inhales, the breathes around the infected child, that child can get infected. The child goes home and it's spreading to the parents, the elderly grandparents at home. So contact tracing is extremely important. And schools need to have a good communication with the local public health team. And they should be able to do it in a real time. Contact them, contact the adults, contact the communities, contact the public health team, get them tested. So all of these things definitely have to be taken into consideration when we thinking of face-to-face school. And this is very, very important that we do this. Resources, more knowledge, more dissemination of knowledge. So what you are doing this afternoon, talking about this and educating your audience, is the critical thing that we need to do as public health experts.
You've mentioned two things that I want to repeat and stress about. First is the involvement of the community and the responsibility that every member of the community has.
Yes.
I think we can't repeat that enough. It is not up to the school alone. It's up to the school, the families, the members of the community, the government, and everybody to make sure that it works. If we decide to go back to school in person, everybody has a role in making sure that this works.
Definitely.
Something that I can't stop repeating. And I've been saying it in I think all of the webinars we've had. I've repeated this over and over again because I think we sometimes forget the responsibility we have as a community.
Yes.
So I just want to repeat that you mentioned it a few minutes ago. And the other thing that you said that is extremely important for me is that it doesn't work the same way for every school and every community.
Definitely.
We have to find solutions for our specific school, solutions for our specific community. And when you talk about community, there's another question I have for you. So
Yes.
currently, our Ministry of Education and our Ministry of Health, they've assigned a 5% positivity rate
Yes.
as a condition to going back to in-person schooling.
Yes.
A community has to have 5% or less positivity in order for them to have in-person schooling. And when we've checked the CDC recommendations and the WHO recommendations, that's like the lowest risk available. And that would mean that we're almost back to normal. So
Yes.
we really understand why we have to wait for that low positivity rate, or if there's another threshold that we could maybe target and try to achieve. What are your thoughts on that?
Yeah, that's a great thought there, and that's a very important thing too. And we need to remember CDC saying having 5% or less. It's based on studies that have been done in United States and other countries that have tried to open the school and go back. And in fact, in Jamaica, that's the same rule we use, 5% or less in a local community. And I know that it's almost equaling to nil, but how we have to, at this moment, the only way we are going to able to survive through this pandemic and to beat the virus, to get back to closer to normalcy, is by practicing as much as possible the social distancing and not making ourselves available, because that's our personal responsibility, for the virus to make us as hosts to infect and replicate and mutate and spread and take over the world, is to contain the virus. And one of the way we can contain the virus is by social distancing, 6 feet away. And if that has to be done, we have to do it. We have to get better control. And I do understand that schooling is extremely important for our children, not just for the knowledge, for greater well-being of a society. Otherwise, we're going to have a lot of kids that are not focused. Currently in Jamaica, if you, I can only speak about Jamaica at this time. Not many people can afford internet for homeschooling. Data is expensive. Internet using a smartphone is expensive. So continually to be on a classroom for 6 to 8 hours, that amount of data, or to provide a constant Wi-Fi, having a smartphone, at least 30% of the parents in the community, they're not able to. So those 30% of the children have not been in the classroom, or if they have been in the classroom online, if it's 1 or 2 days for the week or 5 days of school. And that puts a dent on their learning. That puts a lot of pressure on them, on already struggling kids, whether they're struggling academically or they're struggling emotionally. Kids being asked by other kids, So my nurse has a kid who is 7 years old, and she cannot afford to have the child at home because she doesn't have the Wi-Fi here. So she brings her to the hospital where there is a continuous Wi-Fi. But bringing her to the hospital is putting the child at more risk for the child to get more exposed to COVID-19, where we already have a lot of cases. So you're losing it either way financially. When we talk about the top 10% of the pyramid of kids, they're able to afford. They're fine being at home. They're doing all the precautionary measures. The parents are teaching them. They're 24 hours. They have internet and they're in constant touch with the teachers and they're doing well with the remote learning. But is it the only top 10% that we want to attend at this time? That's the question that we have to address. Are we achieving anything? And this at the same time, are we going to put our kids at risk by sending them back to school? So this is why I was stressing, and also the CDC and WHO stresses, make individual assessment of your schools, your communities, the rate of spread in that community. We as adults, we have to take responsibility. We have to teach our children, we have to teach the community, and by living it, not just by talking about it. Imagine I'm talking all this and talking at a podium, addressing parents, and I myself have the mask below the nostril, because I'm not able to talk. Churches were kept. Churches, it's a very important part of Jamaican system, is church religiousness, spirituality, and some people have taken into that. But pastors are preaching, choir is singing without a mask. That has become another place. So we need to take responsibility. We need to see the risks and outweigh the advantages and the disadvantages of everything, and do the right thing, the best thing at this moment, at this time. We have to work on that. And it's our responsibility to train our children to, go through this, to do the best thing, to learn and work with it. Government is trying to provide the internet in Jamaica, but again, smart tablet distribution, that takes resources, that takes finances. That we are a third world country. We cannot be distributing the smartphones and the tablets for everyone. So how are we going to afford the internet, right? So it's an individual decision. It's a community decision. And that is why CDC says if the transmission rate is below 5% in the local communities, that's an important take-home message for us this afternoon.
Thank you so much. You're talking about what happens in Jamaica, makes me think a lot about what happens here in the Dominican Republic.
Yes.
We have a lot of similar things going on.
Yes.
Our Ministry of Education has a nationwide plan for education, and they're using television and radio. So
Yes.
we're depending more on that than we are on the internet, because we don't have that wide data available for the whole country. And we also don't have technology for every student. So they're using the radio and they're using the TV. But as a teacher, I can tell you it's not the best way to teach our students. And we're at a point where we have to see what is riskier, keeping them out of school or sending them to schools after we've made sure that schools can be a safe place. And after I say this, I just we're almost at the end of our interview, and I want to know if you have any final thoughts conclusions, recommendations? What can you say to everybody that's watching us now?
Vivian, let me tell you that this topic of COVID and kids and schooling, it's a highly debated topic at this time because we are seeing kids suffering. Kids have been depressed. I hear parents talking to me all the time that kids are locked up in the house. Kids have not seen sunshine. Kids have not been interacting. They have lost the social skills. They have not been sleeping well because they do not know the day different from the night. Most of them are up all night and they're sleeping during the day. Like they don't know the nocturnal different from the daytime. But this is the most confusing time for public health experts, world at large, and everybody is still in the learning and evolving curve with this virus. Were we prepared for a pandemic like this? Probably not all countries, at least not all the third world countries. But definitely when we're talking about kids and COVID, we need to think about the long-term effects of this, the COVID, staying home, not having school. We have to think about it because it has caused a lot of behavior changes in our kids, unhealthy eating, sleeping habits, excessive worry, excessive crying, irritations, poor school performance. And some of the kids who were already not doing well or they didn't like the school, it's the best way for them to avoid school. And it's also causing a lot of difficulties with children with their attention and their concentration. They've been avoiding a lot of activities that they enjoyed in the past, basically a bicycling, playing out on the street, mixing with kids, even hanging out at the end of the street with our kids. As parents, as public health experts, as media specialists, we have to understand and know the questions, share the facts with our communities, with our peers, with our colleagues, and also share this information to our children in a way that they can understand, they can relate to. Reassure our children that they are safe. Let them know it's okay if they feel upset about it. Share with them how you deal with your own stress. It's good when you tell your children that you're also stressed from COVID. You're also trying to cope and learn from the stress of COVID, because it's not for them alone. Some of the times what works is also lessening or limiting your children to the news coverage of the event. I had an incident recently. A kid went into a dentist's office. He's about 15 years old. And 2 weeks after, he got a call that the dentist was infected and the child fainted at home because he thought he was going to die. So for me, let's limit our children's exposure to the wider news coverage, including a lot of social media, because children might misinterpret what they hear and they can be frightened about something that they do not understand. And as parents, let us try to keep with their regular routines. Let them wake up at the same time. Let them sit at the schools. Even if it's not enough data available, let them learn something. They have a daily chores. They have a daily routines. Create a schedule for them for learning activities, relaxing, fun activities, do indoor things. Let's be a role model. Let's take breaks. Let's get plenty of sleep, exercise, eat well, connect within our own means with our friends and family members on social media, have a Zoom, talk to one another. So this way, we have to live it for our children to learn from, because they're more confused than us. They are more in a mental fogginess than us. It's more confusing for them. So we have to live a model life, do right things in front of them, and take all the precautions, take all the things until vaccines are available for children, until we do vaccinate wider population, more countries, until we get these vaccines, until they get this virus under control. We have to cope with given situation. And the only way we can do this, Vivian, is by living it. And live and prove it to your children, your family, your elderly parents around, even for me to tell my patients who are 65 and over to get themselves vaccinated, the first questions they ask, have you been vaccinated, doctor? And when I tell them my personal experience with the vaccine, they are motivated. So I'm sure, they ask me a lot of questions. Were you sick? Were you having fever? So education. That's the key point, whether it's elderly, school kids, teenagers. So let's live a life that we mirror what our society has to be, and that's my 2 cents on this.
Thank you so much. I don't even have words for you after this beautiful final speech. We certainly have to do what we want our kids and our elderlies to imitate. It's been hard for us. I can't imagine what it's been like for small children that don't really understand what's going on. So I am 100% agreeing with you right now. We have to imitate, we have to teach them, we have to show them that it is possible to survive this craziness that we're living through. And we're at a point where we have to try to find things to reduce the risk, but we have to keep living. So that's a great takeaway that I have from you. And I just want to thank you again for joining us today, for all the information that you've given us, for helping us bust some myths, for giving us real, accurate information that is definitely going to help us make decisions and continue trying to make this work for the country. Thank you so much. It really has been a pleasure having you here. And I just want to thank the audience for joining us, for going through this in English. I know it is not something that you are used to, but it's important that we are able to talk with people from all over the world, no matter the language. So thank you, doctor. Thank you that everybody.
Thank you, Vivian. Thank you from Public Health Literacy. Thank you for having me.
Before we go, I just want to say thank you to all the companies that usually support us, and I will leave you with a video that is going to show you who they are. Thank you again, and until the next time.
Bye. Thank you.
Agradecemos a las siguientes instituciones y empresas que hacen posible el trabajo de EDUCA: Banco Popular Dominicano, Caucedo Development Corporation, Grupo E. León Jiménez, Asociación Popular de Ahorros y Préstamos, Inicia Educación, Fundación Propagás, Grupo CID, AFP Crecer, Organización Cisneros, Indusnig, Claro Dominicana, Barrick Pueblo Viejo, Parque Industrial Itabo, Fundación Logos, NAP del Caribe, Squire Patton Box, Marítima Dominicana y Novocid.